So we are almost there. दर्शकबिन नमस्कार, गुड इभिनिङ। त्यसै गरिकन काठमाडौँबाट हेरिराख्नुभएका, नेपालबाट हेरिराख्नुभएका हाम्रा दर्शकबिनहरुमा गुड मर्निङ। के त भन्दाखेरि घडीले 7 बजाइसकेको छ, यो टेक्ससको टाइम। अब आजको दिन शनिबारको दिन यो साँझ हामी टिएनएमए फ्यामिली है, टिम टिएनएमए टेक्सस नेप्लिज मेडिकल एसोसिएसनको तर्फबाट हेल्थ अपडेट लिएर आएका छौं हैन। आजको विषय एकदमै के त भन्दाखेरि इन्ट्रेस्टिङ छ। इन्ट्रेस्टिङ इन द सेन्स दैट यो कोभिडको बेलामा हाम्रो मेडिकल फिल्ड अर्थात् चाहिँ के त भन्दाखेरि मेडिकल फिल्ड त सधैँ नै के त भन् त्यतिकै जरुरी छ, तर अझ कोभिडले के गर्दिएको छ त भन्दाखेरि यसको इम्पोर्टेन्स अझ राम्रोसँग उजागर गर्दिएको छ। यस मानेमा के त भन्दाखेरि अहिलेका जुन हाई स्कुलरहरू छन् हैन, दे आर रियली मोटिभेटेड यो फिल्डमा जानको लागि। अब के गर्न सकिन्छ त त्यसको लागि हैन, यो नै के त भन्दाखेरि आजको मेन विषय हुनेछ दर्शकबिन। अब हामीले यो विषयमा अगाडि बढ्नको लागि विभिन्न स्रोत व्यक्तिहरू हामीले निम्ति आएका छौं हैन। उहाँहरू के त भन्दाखेरि यो फिल्डमा कसैले ग्रेजुएट गरिसक्नु भएको छ, कोही दे आर अन द वे हैन। सो हु क्यान गिभ यु अ रियल पर्सपेक्टिभ है, उहाँहरूको यो मेडिकल फिल्डमा के छ कसो छ हैन, त्यसबारे जानकारीहरू तपाईहरुले दिनुहुनेछ। तपाईहरुले पनि धेरै क्वेशन्सहरू पठाइसक्नु भएको छ हैन, त्यसको लागि थ्यांक यू। अब यो आजको यो हेल्थ अपडेट एपिसोड नम्बर 10 स्टार्ट गर्ने तर्खरमा छौं। म प्रमेश श्रेष्ठ यहाँलाई स्वागत गर्दै अगाडि बढ्ने तर्खरमा म डाक्टर सञ्जीवलाई आफ्ना केही वर्डिङहरू राखिदिनु हुन म अनुरोध गर्दछु। डाक्टर सञ्जीव।
Namaste, good evening, and good morning to all our viewers in Nepal. Today, I'm really glad to be here with all these young, talented professionals. I want to thank each of them for being here today. We have speakers from the East Coast and the West Coast. The goal of our program today is to acknowledge and highlight the achievements of our current younger generation, and secondly, to motivate our high school students to go into medical related fields. It is said that the journey in the medical sciences is often long and arduous, and the programs are often 4 to 8 years, however, well worth the sacrifice, as our young professionals will describe today. We have an excellent group of talented individuals who are currently in medical related professionals, including medicine, dentistry, pharmacy, today, and hopefully in the future we'll have other speakers from different medical related professionals. As many of you might be aware, there are so many different ways to get into the medical sciences, and besides these just explained, there is also chiropractor, physiotherapy, research, there is MD, PhD programs, and also other related like nurse practitioners, physician assistant, radiology. So there are so many different opportunities, and the high school students might not be aware, or if they are aware, they might have little apprehension in going into this field. So today we're going to highlight what are the specific fields available by highlighting the individuals who are here today and who have succeeded in medical school, in dental school, in pharmacy school, in various research program. So again, as I mentioned, that is the goal, mainly to motivate our high school students to see what is available, and also to get our young professionals here today as mentors for high school students, and in fact for parents. If they have any questions, they can go into TNMA and send us questions. But at some point, these young professionals have all agreed to even be mentors, and I'm so proud that each and every one of them here, and Jessica Bandari, She has organized this function. She is a fourth-year medical student. So I'm going to give the floor to Jessica. Each professionals will talk 6 to 8 minutes, and then we'll have questions in between. And at the end, we'll have more questions and wrap up the program. Jessica, floor is up to you now.
Hi, everybody. Thank you, Dr. Sanju, Uncle. You've been super great and supportive of everything that we wanted to do. My name is Jessica Bhandari. I'm a fourth-year medical student at the Alabama College of Osteopathic Medicine. So we kind of put this program together with the same purpose that Sanju Uncle was saying. We want to talk to you guys because it's COVID and everyone's bored and sitting at home. And I thought that, I'm really appreciative that everybody showed up today and you guys have listened and been a part of, worked really hard to make this PowerPoint. So we can send this out to you guys later. At the end of the presentation, I have a Google link form. So any students that are interested, you guys can sign up and we will pair you guys with mentors. There's a lot of people who also told me they're interested in being at this program, but because of scheduling, they were working, they weren't able to come. So we have people who also want to mentor who aren't necessarily here today. So I'm going to go ahead and start. I'm going to let our first speaker go. She can introduce herself.
Hi, everyone. Good evening. My name is Nikita Chapagai. I am a first-year medical student at Alabama College of Osteopathic Medicine. Prior to medical school, I worked as a full-time researcher in a traumatic brain injury lab at the National Institutes of Health. And prior to NIH, I went to Baylor University, where I graduated with a degree in neuroscience. So a little bit about me. And just what brought me to medicine and why I want to go to medical school, or why I'm in medical school, is that in high school, I went to high school in north of Dallas, in Frisco, and my high school had a specialized career program. So we got to take some career classes with our high school classes, and I graduated with a CNA, EKG, Pharm Tech license. And so I had worked a lot of odd jobs throughout the hospital, seen a lot, had a lot of clinical experience, but I was still kind of unsure on what exactly I wanted to do in healthcare. I knew I wanted to go into healthcare, but wasn't really sure what. And the experience that really solidified it for me was this campaign called Heal a Heart. So I teamed up with a group of surgeons in Dallas, and we raised money. I started this campaign called Heal a Heart, and we brought a baby from Nigeria, and here's a picture of me with him for a free heart procedure, essentially. So that experience, having that experience early on really just kind of solidified that I wanted to be in science in the role of a physician. And then there's just some more fun little pictures of me and my Heal a Heart baby. We still keep in touch, me and this family. He actually just turned 6 years old about 2 weeks ago. So that was a really awesome experience for me. And then going into college, I knew I wanted to go to medical school, but I'm really ambitious. I love being a leader. I love talking science with people. And I think all of these traits led me to research. But I knew nothing about research. I had never done it. To me, it was just working in a bench under a hood with test tubes. I really didn't know a whole lot about clinical research working with patients. So I started working in a sleep neuroscience lab at Baylor, and there I got to see patients, and it just kind of opened up a door for me. It taught me that I really enjoy research. I really enjoy science. I really enjoy asking questions, and so that led me to pursue research full time. So I worked, like I said before, I worked in a traumatic brain injury lab at NIH, and there I got to see patients for our group and got to work with some data and do all that stuff. But overall, all of these experiences have just kind of taught me that I want to continue research as a physician. And so I'm in the next stage of my life, which is getting my doctorate degree. And so I, want to encourage anyone who is even slightly curious about research and maybe a little afraid to approach it like I was. You never know what you're going to gain out of it. Research is a lot of fun. I have some other pictures of me and my team. So it is a team effort. You're never alone in this. You get to travel a lot. There were pictures of me at conferences. You get to meet a lot of really awesome people that shape you and help you grow along the way. This is a picture of my team at NIH. We actually won first place in a gingerbread baking contest. So you get to have fun. You work with a team, and it's a wonderful, invaluable experience. I just want to kind of conclude with two pieces of advice. And first is just to be honest with yourself, be honest about what you're interested in and what experiences you want to have. And then secondly, just don't be afraid to ask. It's a lot of networking. Like Jessica mentioned, we have our emails listed in a Google Doc. So if you're interested in research or curious about, the opportunities at a university nearby, or maybe even in high school, ways to get involved, don't hesitate reaching out to us. We would all be, more than happy to help you. And yeah.
Awesome. Hi, everyone. My name is Adar Shamala. Thank you, Jessica, for your efforts towards organizing and having me. So as the slide kind of shows, I'm currently a second-year medical student at the University of Maryland School of Medicine in their MD PhD program. I was originally born and raised in Georgia, and before entering the MD PhD program at the University of Maryland, I went to Johns Hopkins University for undergraduate training in biomedical engineering. And so a lot of people don't really know exactly what an MD PhD program is, or that it exists. So just kind of briefly, kind of a summary of what exactly the goals of an MD PhD program are and kind of what it entails. So it is a pretty long program. It's a 7 to 8 year program. And by the end of the program, you will have attained both your MD and your PhD degrees. And the goal of the program is to essentially make the training more integrated versus doing the training separately. In addition to that, there are a couple of really cool advantages. One of the biggest ones is that you get full tuition remission, which essentially means that the National Institutes of Health, which is kind of the federal funding for research in the US, pays for all of your tuition, your fees, as well as your health insurance. So you have essentially no loans. You also get a yearly stipend for every year you're in the program. And that ranges from $28,000 to $38,000 per year, depending on your program in terms of where it is in the United States. So on average, the total value per student over the 8 years of the program is about $750,000. So it's a really good value program, and it's a great way to kind of get both your MD and your PhD if that's something that you're interested in doing. And so now that you know a little bit more about MD PhD programs, you might be interested in why exactly you would pursue it, or what exactly would make sense in terms of your experience and why you want to do this. And so just briefly, research in general is kind of divided into two basic categories. One is basic research, which is focused more on questions like why, what, and how. And so this is kind of the research that people mostly focus on who have PhDs. So this is a lot of bench research that's focused at looking at mechanisms and understanding biology in cells and animals. And then the other category is applied research. So this is the kind of research you see most physicians and clinicians performing, which is essentially focused on taking the knowledge that we've discovered in basic research and trying to apply that in a way that's useful for the world, whether that's in health or infrastructure or politics, et cetera. And so, next slide. And so by getting both the MD and the PhD, you're essentially able to oversee this entire process of not just focusing on, mechanisms that occur in cells and animals, but you're able to actually take what we learn in those models and apply them to patients, and apply them in clinical trials, and essentially see a discovery that was found, at the bench in cells, and see that progress through working in animal models, and then modifying that to be tested in humans, and then modifying that even more based on what you learned to actually be applied on a population level to essentially take something that was discovered in a lab and allow it to have an impact on a population basis. And in addition to that, you also, of course, get to practice medicine. So if you're interested in kind of this, a big picture research approach and having the experience and the training to take a discovery that you made in the lab and actually go through the numerous steps that's required to allow that to have an impact on people, then the MD PhD training is generally something that's encouraged.
Hi, everyone.
And then, sorry, so more slide. And then, so just pieces of advice I think that would have been useful for me in high school, even that was quite a bit ago. I think first and foremost, don't let yourself get complacent. I think, based on the areas that we grow up in and the friends we have, it's very easy to kind of get comfortable with our achievements. But everyone here who, are in the positions that we're in, got here by essentially seeing beyond that, or not being comfortable with what we have achieved and what we're surrounded by. So, even when you go to college or even currently in high school, always try to push yourself, always try to see what more you might be able to do towards your interest. Secondly, I think you should be picky but open about who you surround yourself with. Because again, kind of going off the first point, really the people around you are going to contribute to the ideas you have and your aspirations and kind of your view of the world. So just surrounding yourself maybe with people who are interested in science or interested in business is really going to make kind of what you know about everything going on in the world very narrow. So even if medicine and clinical careers is something you're interested in, I think surrounding yourself with people who are from a variety of backgrounds and are interested in a variety of things is very useful to your success as a clinician. And then number 3 is the very popular African proverb, it takes a village. So I think now, especially in high school, it's really hard to appreciate and understand a lot of the things our parents tell us. But looking back, they're pretty much right about everything. And it'll take a couple of years for you to understand that. But essentially just appreciate your parents, appreciate your mentors when they do things for you, like maybe writing a recommendation letter, or if a physician lets you shadow them in their clinic, maybe, write a thank you note and just try to, keep your mentors and friends close, because it really does take a large group of people for you to be successful. Number 4 is significant things you build now will last you a decade or more. Even though I am pretty far, almost a decade past high school, a lot of the things I did in high school are still things I can talk about today and experiences I can talk about today. Sports, you're able to build leadership, you're able to build communication, you're able to build working in a team. Any projects you work on in high school. So now it may seem kind of far from your final career, whatever year in high school you are, but starting to think about things and things you're interested in will benefit you down the road for a long time. And then lastly, spend time thinking about what you enjoy. I think a lot of the friends I even talked to when we were graduating undergrad, so as a senior in college, a lot of people still weren't sure exactly what they were interested in. And that's also okay. It's likely going to happen. But I think if you spend time even now, early in your kind of life and career, kind of reflecting and thinking about what you enjoy and what kind of impresses you and what's exciting to you, that'll help a lot down the road in terms of identifying, what you may want to do with your life. And yeah, so that's all I have. And I'm very interested in mentoring. So if anyone has any more questions or would like help with applications and such, just let me know.
Thank you, Nikita and Adarsa, for those pearls of wisdom. As both our speakers described, it seems that if you have a research interest, often you are able to progress in that further in college. It's really helpful to have a mentor. And that is one goal of TNMA, is to generate that type of mentorship for our high school kids. And for our current young professionals to be able to tap into any resources we have in TNMA, we want to facilitate that, because as Adarsa and Nikita pointed out, how important it is to have mentors. And at the same time, if you're interested in research, you want to get that project going in, later in high school or definitely in college. And the other thing struck me as both these young professionals had worked their way up, like Nikita did an EKG technician. Others, I know, did EMT, and he was an EMT at Johns Hopkins for a long time. So it takes a little longer, but if you have the end in mind, I think you can reach your goal, as these two excellent professionals have shown. Thank you for those pearls of wisdoms.
Hi, everyone. I was really anxious to talk to you earlier. Sorry about that. My name's Sakshi Oda, and I graduated from nursing school in 2017 at the University of Texas at Arlington. I worked in the ICU for 3 years, and now I am back in school to get my doctorate degree in anesthesia. So first I'll talk a little bit of the nursing world, and then I'll explain more of what a CRNA or anesthesiologist does. So as for nursing, required is an associate's or bachelor's degree, but most hospitals nowadays do require a bachelor's, or if you get hired on with your associates, you have like a certain time limit. They'll give you maybe a year from your hire date to get your bachelor's. Most of my colleagues in the ICU were required a bachelor's, and it's not typical from right when you graduate to get a job in the ICU because it is a little bit more intense. Things that I would recommend to get into nursing school includes kind of what Dr. Sanjeev was talking about, getting a CNA license or working as a tech. That really helps. Different positions in the hospital, you can kind of see where you fit in and what kind of unit you would like to work on. And then while you're in nursing school, you should be going through clinical rotations, so you'll kind of find your area of interest that way. Nursing work in the ICU is a little different than pretty much the rest of the hospital because the patients are very critical and they can deteriorate very rapidly. So we try to have the patient ratio, nurse to patient ratio, lower than the rest of the hospital. So typically we have 2 patients to 1 nurse, or sometimes if we're really short, we'll have 3, but a lot of the times with more critical patients, with that machine that you see in my slide there, that's a CRRT machine for kidneys, you're having to perform dialysis and those patients are already at such a critical level, it'll be a 1-to-1 patient ratio. The reason that I like working in ICU is because the patients, like I said, are very critical, so they take a lot of brain power and thinking about all of the different things that are going on with the patient. It's not typically just one problem that you treat, but several different comorbidities going on that you have to kind of think about what system will affect what, and it just is very interesting. And you are required to be ACLS proficient in the ICU because we do have a lot of patients that could code at the same time. So we can't always wait for a doctor or a nurse practitioner or someone to come and run the code. We'll just have to start compressions and give the drugs. So you do need to be pretty comfortable doing ACLS. My personal experience, when I was in high school, I actually volunteered at the same hospital in the same unit that I ended up working in my ICU at Baylor All Saints in downtown Fort Worth. When I was in college, I realized I wanted to go into nursing and started out as a nursing major. Once I got into nursing, I started joining more clubs and was part of associations. We would run blood drives and all of that. And we would have speakers come and talk to us from different units and different areas of nurse practitioners. And one day we had a CRNA come speak to us. That day was kind of when I set my goal, as I could definitely see myself doing this in the future and set my goal towards that. So I did more research to figure out, you know, how to go down that path. And I realized that I would need a job in the ICU as soon as possible if I wanted to take the shortest route there. So I did graduate in 2017 and thankfully got a job in the ICU right after school. But I started as a graduate nurse through a residency program. And so I had like a month of orientation before they let me fly solo. Since then, a year into it, I got kind of promoted to the charge nurse. So you know, the other nurses that were working on the floor, I didn't have direct patients of my own, but I would help everybody else kind of manage their patients and kind of served as a team lead. Along with that job, I had to take on the role of RRT, or rapid response team leader. So anywhere throughout the hospital, if there was a code or some sort of emergency going on, we would go and run the code or just help out manage emergencies throughout the hospital. And I worked night shifts, so we did not have doctors at night most of the time there. We did have nurse practitioners on call. So for CRNA school, the requirements are at least 2 years of ICU experience. Your CCRN is a certification that I got. You have to have a year's worth of ICU experience to take the exam. And then if you pass, you get certified for it. So ACLS, BLS, which are both CPR certifications, and PALS for pediatrics, some shadowing work, and then you do require a doctoral degree as of, they're trying to change that requirement. So as a CRNA, you provide anesthesia, place all arterial lines, central lines, and then my favorite thing is intubation. You put in breathing tubes so that the patient can be on a ventilator and you breathe for them, kind of. You can work in a surgery clinic and or in the hospital setting. That's fine. Advice that I have in high school, just try kind of what everybody else has said, research your options and find what you're interested in. It's okay to not know exactly what you want to do. It does help if you have some sort of plan though. For nursing school, like I said, try to find a tech job and find which unit is the best fit for you. For CRNA school, take as many certification exams as you can to kind of build up your resume. And I want to say that grades don't matter, but they really do. Most of my interviews were personality based because they kind of just use a check mark. Did they meet this grade? Did they meet these criterias? And then they kind of see if your personality fits. The great thing about CRNA route is that you can work as a nurse until you're ready to go back to school. So it's not like a waste of time or anything per se. You can save money, work as long as you like it. Once you feel comfortable, apply to school.
Okay, hi everybody. I'm so excited and honored to be here to speak to you guys about the dental field. My name is Angela Adekari, and I'm a second-year dental student here in Dallas at Texas A&M College of Dentistry. I got my bachelor's in biochem at ACU, and I just wanted to start off with saying just a couple things about why I chose dentistry. I always knew like a bunch of these people that I knew I wanted to be in the dental or in the medical field, but I wasn't sure in what capacity. But certain aspects were important to me. You know, I shadowed a bunch of physicians. I even worked as an EMT for a little bit, but something felt like it was lacking. And I actually got to volunteer at a dental event where it was a volunteering event where a lot of the patients from the lower income areas would come in to get treated. And it wasn't until then that I recognized the true need of oral health in this country. A lot of patients would wait for hours and hours, like take buses from hours away just to be seen. And to me, then I realized, you know, it wasn't just a cosmetic aspect of, oh, like I'm not really happy with how my front teeth look when I smile. It was really like a functional aspect too. Like they weren't able to eat some of their favorite foods or any of those other things. So just seeing like kind of the life-changing parts of, you know, dental care was just something that interested me to that field. So there's a lot of different things that you can do with a dental degree. I just wanted to touch on some of the experience that you need. You do need like a bachelor's degree. Next slide on there will show you more about like the specific requirements, but these are just found online. For the most part, you do need like the same bachelor's degree that you would need to get into medical school. Every school has their own specific requirements, and I would really encourage you guys to be really involved in whatever you guys can do. I was really lucky to serve on a lot of executive committees. I served as the president of our pre-dental organization, and I tried to stay involved in other things that I enjoyed, like some intramural clubs. I like to play soccer, and I just try to stay involved and really form like a real well-rounded application. I think that's really important to do. Volunteering personally is really important to me. I like to give back to the communities that I'm surrounded by. So I spent a long time doing that too. With dental school itself, there's different requirements. Like I mentioned, you need to take the DAT. It's the same thing as them taking the MCAT or anything else. But with dental school itself, the first 2 years are mostly didactic. You're doing a lot of learning about the body system. The really cool part is our boards now are integrated, so you're getting a really full understanding of how the body systems work. And you do get a clinical exposure, which is really nice. I'm starting to see patients in the spring and doing my own treatment on them, which is something that I really like doing. That's another aspect of dentistry that I really like. You know, sometimes if you go and see a healthcare provider, it takes a little bit to see the effects of treatment, right? You give them medication and you don't necessarily see the effects right away. But with dentistry, you're able to provide a treatment plan and then either get them treated for the same thing, like if they have a cavity, right, you're able to extract in the same appointment, or you know, you make a treatment plan to where you're eventually able to do that. So that instant gratification is something that I really enjoy. And I really enjoy, you know, the artistic parts of dentistry. You're able to use your hands directly to directly impact how a patient smiles, right? That was something that I'm sure for a lot of people, You know, I grew up with a bunch of orthodontic care, so I was really insecure about my smile. So being able to do something for people who, you know, have those insecurities is just really, really nice to be able to do. A lot of this information that Jessica has on the screen is things that you can find online. The thing I want to highlight here is I didn't understand that there's different routes that you can go with in the dental field. They have different specialties. They have orthodontics, they have periodontics, you have pediatric dentistry, and everything else that I've listed here. The great part is you don't have to specialize. For me personally, I like doing a little bit of everything. So for me, general dentistry is probably where I'll end up. So just having the ability to still treat patients in a very unique way is something that I chose. And as always, like Jessica said, and everybody else has said, is I love being a mentor. Something I did over the last summer was I worked with the dental school in the summer pre-dental program, and I worked with like a lot of high school seniors, such as yourself, and we got them really interested in dentistry, and that was a really cool experience. So if you guys have any questions about your application or what to do, I know I went over it very briefly, but this information is available online, and you guys have my contact information, so do not hesitate to reach out and ask me any other questions that you have. Thank you guys again.
Okay, hello everybody. I'm Shabana and I'm from the Dallas-Fort Worth area. I am a fourth-year PharmD student at the University of the Incarnate Word in San Antonio, Texas. I got my bachelor's in biology from the University of North Texas in Denton. So as I mentioned, the program I'm in is a 4-year-long doctorate of pharmacy program. Most schools, Jessica, do you mind going to the next slide? Thank you. So I've listed my application requirements, and most things are school specific. So GPA requirement, you know, the one school may have a different GPA requirement than a different school. So it's really school specific. So you just kind of have to look into what school you're interested in going to and what their requirements are. So I've listed these just like the core of, you know, what all schools require, and hopefully this will help you. If you have any other questions regarding the application requirements, feel free to reach out to me. So as I mentioned, the 4-year doctorate program, biology, or I majored in biology and I got my bachelor's, but it's not required. You can also just complete your prerequisites to get into that specific school. So some schools have something called a pre-pharmacy program. My school offers that, and a lot of other schools do too. So this is basically like a 2 to 3 year program, which you apply to right out of high school, just like you were applying to colleges. And you basically 2 to 3 year, you do your prerequisites in that time. And so it depends on how much course load you can handle. So some people finish early in 2 years and then they go into the 4-year doctorate program. So this, you know, kind of is a shortcut rather than doing 4 years of bachelor's and then another 4 years of doctorate program. So it's not much of a difference. It's 6 to 7 years versus 8 years, but it's something to think about and it's a shortcut. So that's that. But I decided to get my bachelor's degree because I knew I wanted to be in the medical field, but I wasn't exactly sure what I wanted to do. And it was my junior year of undergrad when I really knew that pharmacy was what I wanted to do, as I started working as a pharmacy technician. And, you know, I could see the difference that me and my team brought into people's lives. You know, the fast pace and, you know, you're just growing as a person. You learn brand generic drugs. You learn, you know, what this drug is for. Like a patient will call, they don't know the name of the medication, but they know that it's for their cholesterol. So you kind of have to use your brain to figure out like what medication, you know, they're wanting to get filled. And so that really, really helped me. And, you know, patient would come to the pharmacy counter asking for recommendation, like I have this going on, what can I do? You know, just over the counter stuff. And so that really helped me grow as a person. And I knew that this is what I wanted to do. And so sure enough, I applied to pharmacy schools and I started school in fall of 2017. And so to give you just a general idea of what a pharmacist does, it's basically medication management. So patients see different providers, you know, they see different specialists, and they don't always remember all the medications they're on. They don't always communicate that to all the providers that they're seeing. And so this is where we come in and see, you know, when the providers sends in a prescription, you also see a prescription that's being sent in from another provider. So then you kind of evaluate that, and you evaluate the therapy, and you kind of make sure that they're taking the right drug for the right reasons, and there's no interactions that could be fatal to the patient. So just those kinds of things. It's really fun, like communicating with the providers. You know, you prevent the patient from falling through the cracks because of miscommunication. That's what the pharmacist does. And so I think just being in the medical field is just something to be proud of. And, you know, we're helping patients every single day, and that's just something that gives me joy. I think that I put the slide up there. Yeah. So I have some pieces of advice for you guys, and I highlighted or bolded the most important one, I think, is shadow someone that works in that field. It shouldn't be, I mean, it's not necessarily just for pharmacy, just for any job that you're wanting to get in the future. Just shadow someone and, you know, just see what your day would look like in that job, and, you know, make sure that's what you want to do for the rest of your life, because what's the point of working so hard when you're not even happy doing that, you know? And so basically what everyone's already said, I just want to reemphasize that. And most schools are now doing, I know at least for pharmacy schools, I'm not too sure for other schools, but most schools are now doing multi-mini interviews, which basically means they give you scenarios on the spot, and you kind of have to role play, and you come up with a, you know, action plan for the patient. So I know that's how mine was, and having a job and, you know, seeing all the scenarios in real life really helped me come up with an answer right on the spot. Networking is key, just like in any other field. You have to maintain good grades to even be qualified for an interview in pharmacy school. So that's always there. And try to get leadership positions in different organizations in college in order to build your resume and CV, you know, just like you would in any other profession. So I am also really interested in being a mentor and, you know, to help you guys out in any way that I can. So Jessica does have my contact information, and if you guys would like any other information, I know for the sake of time, we had to make our presentations pretty brief. So please feel free to reach out to me. I'd be more than willing to help you guys in any way that I can. Thank you.
Great, thank you so much. हैन अहिलेसम्म जुन हाम्रो अगाडि बढिरहेछ दर्शकबिन्दुहरूले पनि क्वेशनहरू पठाइराख्नु भएको छ हैन डेफिनेटली के त भन्दाखेरि इट्स रियली नाइस स्टार्ट भनेर भन्नुभएको छ हैन धेरैले मन पराउनु भएको छ त्यसको लागि थ्यांक यू। अब अहिलेसम्म जुन हाम्रो गएको छ हैन उहाँहरुलाई के छ त क्वेशन भन्दाखेरि एउटा इट्स काइन्ड अफ अ जेनरल क्वेशन। यसमा के भनेर आएको छ त भन्दाखेरि अब अहिलेको हाई स्टुडेन्टहरु हैन उनीहरुले कसरी प्रिपेयर गर्नुपर्छ यो मेडिकल स्कुलमा जानको लागि हैन apart from their grades, definitely academic grades त हुनु नै पर्यो हैन त्यसको साथै के त भन्दाखेरि एक्स्ट्रा करिकुलर एक्टिभिटीज मा के गर्दाखेरि चाहिँ इट विल बी हेल्पफुल सो दैट दे क्यान गेट द गुड स्कुल भनेर भनेको छ है। म अब यो फ्लोरमा राख्न चाहन्छु हैन म यसको लागि जेसिकालाई नै भोलिन्टियर गर्न म रिक्वेस्ट गर्दैछु।
Angela said she wants to talk, so she can answer this. I'll talk about it in my talk.
Right.
No, I just wanted to add briefly. So a lot of us were very involved in any aspect, whether it's from high school to college. It wasn't just like to build your resume. I think you should really find something that you're passionate about doing and just pursue that. So for me, it was like working with inner city kids, whether it was tutoring programs. I wasn't great at sports, so I didn't do that. But I think Nikita added that she did the Build a Heart campaign, and that was something that she pioneered by herself. So anything that you're personally passionate about, I would advise doing, because if it's something that comes from like just something to add to your resume, you know, you're not passionate about it. And during your interviews, the doctors, the physicians are asking, okay, what kind of provider will this person be? And by your answers, based on how passionate you are about whatever it is you're talking about, that'll be pretty evident to them. So just pick whatever you're interested in doing. And as long as you're involved in something, continuously rather than like in little segments, that'll be great for your application. And Jessica will add later too.
Oh, sorry. I just wanted to add one little thing on that note. It's important to do things that you're passionate about, yes, but I mean, you should have hobbies in general. I know all of us are like tired students and, you know, we're working towards our goals, but we have hobbies. We have things that we do to blow off steam. And that was something that was asked of me in all of my interviews for both research and medical school. So they will ask you, what do you like to do for fun? What, you know, who are you as a person, not as a student? They can see who you are as a student on your resume. They can see your GPA. They can see all the, you know, leadership and wonderful organizations that you're a part of, but they also want to get to know you and your personality. So it's important to have hobbies. I think all of us have kind of hinted or highlighted, you know, I think all of us have a great support system and friends that we can, you know, have fun with. But that's something to also keep in mind. You don't have to do an organization or something that you think is going to look good for graduate school or, you know, like a professional thing. You can do like a hiking club or, you know, whatever it is.
Yeah, I just wanted to add, that's such an important point, that you have to be genuine in whatever you do. It does not necessarily have to be a medical professional related. If you're very passionate about doing some work in Nepal, teaching students in Nepal, or you're passionate about women's health in Nepal, anything which you're passionate about is most important. And I'm sure all our speakers today have their favorite extracurricular activity. Maybe at the end, when they have 1 minute each, they would just tell us that, hey, this is my favorite hobby or extracurricular activity. Jessica, who's the next speaker?
Me.
Okay.
Okay, hi everybody. My name is Jessica Bandari. I'm a fourth year medical student at the Alabama College of Osteopathic Medicine. I did my undergraduate at Texas A&M University in College Station, Texas. I guess I'm the point of contact for this program. So this is why everyone keeps referring to me. I'm just going to talk to you guys about medical school, kind of ins and outs, and then a little bit about a passion project that I worked on in undergrad that I thought really defined, you know, and helped me figure out what I wanted to do with my life. So to get to medical school, typically you get a bachelor's degree. Some schools just require you to do the prerequisites. If you're like you're a non-traditional student and you're trying to go back, you can just do the prereqs and use your old degree. But that might be changing. So you just need to complete the pre-med requirements. Usually it's like biochem, normal statistics, physics, those things all apply. So I think one thing, whenever you're going into undergrad, don't ignore your like math classes, because like newsflash, it's very, very relevant, drug doses, everything. So, you know, take your time to actually learn your classes whenever you're doing your bachelor's degree. It's also acceptable to take time off in between. That's really becoming a big thing nowadays. People are taking time off between undergrad and medical school. I personally was on the fence about that. And then I ended up ultimately moving to Alabama for school, which I am happy with what I did, but you know, it might not be the right choice for everybody. Medical school is 4 years long. The first 2 years are preclinical, so it's like textbook work. You're pretty much doing the same thing you did in undergrad. You're like studying for tests. Feels like you're studying for finals every 2 weeks. You just keep studying for. And on top of that, you're learning like physical exam skills, and you're doing, you can do some local volunteering and like get in student organizations. At an osteopathic medical school, so at the end of my career, I'm going to have a DO degree. We're also taught in our first 2 years about 250 hours of, it's not physical, I mean, I guess it's kind of like physical therapy, but it's osteopathic manipulative treatment, which is pretty much ways where you can use anatomy to help people, things that I have commonly been able to treat, which I'm really, is like my dad's shoulder hurts sometimes and I can fix it. My sister gets really bad headaches. My friends, my attending actually this week, you know, like twisted her hand during a delivery, and I was able to like kind of reset it because she was having these like shooting pains and shocks down her arm. So that was super cool, and she was very happy. So you do learn cool skills. Not everybody gets really into it, but I think it's very useful. It's gonna be really useful in my patient population. 4th year, you apply for residency. That's what I'm doing now. So I'm applying to obstetrics and gynecology. That's my plan. And yeah, you can do sub-internships, but COVID has kind of screwed that up for everybody. So we're just kind of doing electives and seeing what happens. And then let me tell you guys about my little passion projects. If you've ever met me, you probably know I always have something going on. So in undergrad, I did this medical mission trip to Nepal. I took 16 students. We went to the Hobbies and it was awesome. It was a 2-week trip. We had students that helped with tutoring the kids in the morning. And we also ran a pediatric health camp. One of my cousins, she's a pediatrician in Nepal, and she brought her colleague with us. And so they ran the camp, and we just helped, take vitals, meet the kids. I also did a decent amount of research in undergrad. We can talk about that later. We've talked about research a lot, but because I did research in undergrad, I was able to get a research position in medical school in between my 1st and 2nd year here in Huntsville, which was a really, really awesome experience. Just working with like world-renowned scientists who were just like happy to get to know me, and they were teaching me anything and everything I could ask. This picture down here is from Peru. This was a medical mission trip that I did. It was like 2 weeks long, and it was a good time to meet other medical students and bribe some students to come on a video chat a few years later. And there's this picture down here is from just my clinical rotations. These are my classmates. Everyone looks really happy because we are. And we can take questions in a bit. I'm interested in mentoring. I'm always kind of excited just to let people hear what we're doing. So I have no idea what time it is now. So we're gonna let Dr. Mullah go.
Hi everyone, so I'm Prerna. I'm a 2nd year pediatric resident at UCLA in Los Angeles, California. I, like Adarsha, grew up in Georgia and did undergrad and medical school in Georgia before transplanting myself to the West Coast. Highly recommend, by the way. My kind of path to medicine was, I didn't really think I would do medicine initially. I did engineering in undergrad and I really loved it. But halfway through, I started volunteering more with people and more kind of parallel to the healthcare world, and realized that that's something that I really loved. And I loved working with patients and just talking to folks and interacting with everyone on the healthcare team. Whether, it's the folks at the front desk versus the nurses that are, doing a lot of the work, prepping the patients and getting the history, and then working with the physicians, seeing their relationships with their patients and how, that's such a trusted bond. I really, wanted to get to that level. So after seeing that, it motivated me to kind of switch my path from engineering to med school. And that's, and from there it's history. So like these other folks, they're in school right now, and I finished that, thank goodness. And now I'm in residency, which is really fulfilling because I get to finally put all the knowledge that I learned in medical school into working and practicing with my, my patients. Of course, I'm still learning every day. Being in the healthcare field, it's not like, oh, you finish high school and now you're going to go to college and everything's good. And then, oh, I get into medical school, you learn a lot and then it's done. No, being a part of this field is learning every day something new. You're going to be a learner for life, and you just have to be open to that and ready for that, because it can be grueling sometimes, but it's definitely very, very fulfilling if you're up to it. Let's see. So I'm in pediatrics, which is working from children from, before they're born, premature infants, to newborns, to, toddlers, school-age kids, teenagers. I saw a 28-year-old in clinic yesterday. So, I mean, we even have 33-year-olds coming to clinic. So it's, working with a wide range of ages. But I really enjoy working with, children and their families. It's really you're partnering with the families to, you know, do what's best for the kid. And that's really nice. I did also enjoy internal medicine. So there are many residencies, and I don't know if I even listed them all here. I just wanted to give y'all an overview of what kind of specialties or residencies are out there. So you've got internal medicine, which is like adult medicine. You've got pediatrics, which is knee children. You've got a combined med peds program, which is a 4-year program that you do pediatrics and adults. Family medicine is amazing because you work with newborns all the way to old people. You can do OBGYN care. And then the rest of them I think are pretty self-explanatory. You've got neurology, which is brain, psychiatry, psych, anesthesia, which is really cool, pathology. A lot of these specialties have very diverse lifestyles. So, you know, once you get through medical school and you can kind of figure out what you're interested in, but also what kind of lifestyle you want to have. If you're like done with the working like, you know, crazy hours, you can, you know, choose your schedule, which is really nice. And then just going back to high school, for you high schoolers out there, if you can go to the next slide, whoever's controlling the slides. Thank you so much. I had no idea that there were so many options and careers in healthcare. When I got into medical school, we had an ultrasound program that we, you know, as the students learn to do ultrasound, but I didn't know that you could do that as your whole job, which I think is fascinating. I think ultrasound is an amazing imaging tool. It's non-invasive, it's portable, and it's much cheaper than MRIs, CTs, and no radiation. So, you know, if you want to, you know, if you don't think that going to medical school or dental school or you know, nursing school, if those aren't options, you know, you're like, I don't know about that. Think about being a sonographer. You can work with ultrasound. You have good hours. You can ultrasound, like fetal ultrasound. So that's like babies and like pregnant women. You can do cardiac ultrasounds, abdominal ultrasound. Like it's just, there's so many options. Respiratory therapy. You're like a master of the airway. You're giving people respiratory treatments. ABA therapy, which is amazing, are folks who work with autistic children, kind of, you know, working with them, going through exercises, helping them to build better social skills. Physical therapy, I think, is pretty common, occupational therapy as well. Speech and language pathology, if you're interested in, you know, folks who are having delayed speech or stuttering and you want to work with those folks, I mean, there's so many options out there. So I don't want you to feel like, oh, there's only like dentistry or pharmacy or medicine. There's so many options. And they're all fantastic options that range from, you know, some of them are a year of school to versus, you know, if you're going for the forever school, you know, it's just, you can tailor it to what you want. So I highly recommend, if you have time, to go through and look at these different options that are on this list and seeing what kind of fits your, you know, where you are at this time and what your interests are. Because there are just so many options out there. And I don't know if my path would have changed had I known, but it's just, it's a huge team that you work with on a daily basis. And, you know, everyone's job is so important and really contributes to caring for the patient. And, you know, just to keep your options open. Yeah, and then one last thing I just want to echo from everyone is that, you know, reaching out to folks to get letters and, you know, just for opportunities, it doesn't hurt to ask. It never hurts to ask. If you want to like mass send out emails to, you know, your professors or your teachers, you know, the worst thing they could say is no or not respond, you know. So I definitely feel like, you know, trying, just constantly trying. Yeah, exactly. You have to be literally shameless in putting yourself out there. But it'll get you far, that's for sure. Thank you for having me. My email is also there if you have any questions. Thanks for having me, everyone.
Thank you, Dr. Prerna Molla. She's the physician in this panel. Thank you for all the speakers, but the important thing that Dr. Molla pointed out, and I didn't realize that even in high school, you have so many of those options that you can look into, like being a sonographer, some speech therapy. I believe she said those options may be available even in high school. and definitely in college. And some of the other, I'm so glad that we have so many different medical professions on the panel. Certified nurse anesthetists, pharmacy, dental, these are all so important. But even aside from that, as Prerna pointed out, so many other levels that you can start out with when you're in high school and further develop in college. Well, I think we've finished all the speakers. So we will go to question and answers session. I believe we finished all the speakers, right, Jessica? So maybe Pharmacist, let's see, we have a lot of questions. So we'll try to address each question to each physician, and feel free for people to interject. Pharmacist.
Jessica, if you have anything to say.
Yeah, I have one question from the audience that came directly to my cell phone. Some kids are wondering, does it really matter where you go for undergrad? And I want to hear the answer to this question, maybe from Adarsha, because he went to a great undergrad, and then maybe from somebody else who has any other advice.
Sure. So I personally do not think like where you go to undergrad exactly has a very large impact on kind of where you end up. I think it's a lot about mindset. I think if you truly believe that it's not the location or the school or the hype that's going to make you into what you are, it's really you and your efforts and your motivations, then no matter where you go, that'll drive you. But I think that does kind of touch on what I mentioned earlier in terms of who you surround yourself with. Because I think, going to Hopkins kind of unintentionally, I was just around people who were, essentially just working hard every single day, had insane aspirations, had really great mentors. And so a lot of the ideas I got, and this is why I was telling you guys that earlier, a lot of the ideas I got from people around me, not because I thought to do this research project or thought to do EMT work or thought to go abroad for medical volunteering. It's really because the people around me were doing them and giving me the ideas to do them, and discussing things that we could do in terms of, taking a research project we had and turning that into a startup. So no matter where you go, I think you have to focus on the idea that you really will make yourself into, who you become. It's not the location, but the people around you do have a big impact on that. So again, be picky, but open about who you surround yourself with.
Yeah, and I'd just like to add to that. So I actually had the opposite experience. I went to UT Austin for a year. It was just too big for me, so I transferred to a tiny private school in Abilene, Texas. No one knows where it is. It's Abilene Christian, and I'm at, I would say, one of the best dental schools in the state of Texas. And I'm surrounded by people who either went to great undergrads, and we all end up at the same place. So it's like, I think if you work hard and really make that effort to put your work into what matters. I can't speak for the other healthcare professions, but I do know where you get your dental degree doesn't necessarily matter as much as what you do with it. We mentioned how important networking is, like who get to know your faculty members, and I think that's something that we can all agree with, right? Just go to their office hours, get to know them. You guys are entering college right now. That's something I was really shy to do, and at a big school for me personally, that was hard for me to do. So going to a smaller school, I think that was something that fit my personality type better, to where I was more comfortable doing that. And now I'm, annoying my faculty members now, going to their office and asking them hey, check my prep, check how this tooth looks. And I think that's something that'll only benefit you. You can't be too embarrassed or shy to ask for help. Like, don't ever do that. And I'm sure someone else can add to that if they might.
I guess I have something to add to that. So I went to I think Texas A&M is a big school. Just kind of a caveat, I had applied to medical schools in Texas. I had also applied out of state, and the medical school that I got into, ACOM, was at a career fair that Texas A&M had put together. So there's also benefits of going to a school that, has the resources to be able to do that. I got to talk to the admissions guy right there. I talked to him and was like, hey, I haven't got an interview yet. I'm really interested in your program. And he was like, oh, okay, hold on, wait, what the heck? And the next week I got called in for an interview, and then the weekend after that I got in. So it just ended up spiraling really quickly and worked out really well in my favor. So I feel like you shouldn't say, oh, I don't want to go to a big undergrad, but also it just depends on your personality. Because there were hundreds of kids at that school, but it just ended up going how it did for me. That's it. Did we lose the stream?
Let me see more questions.
Yeah, so a couple of questions. It's very interesting. General question. जेनरल चाहिँ के भन्दाखेरि अब हाम्रो प्यारेन्ट्स साइडबाट हैन प्यारेन्ट्सको के छ त भन्दाखेरि अबाउट द कस्ट है इट्स भेरी भेरी टिपिकल हाम्रो नेपाली क्वेसन हैन मेबी के छ त अब यो तपाईहरुको यो इन इयर कस्टलाई कसरी चाहिँ म्यानेज गर्न सकिन्छ हैन वा स्कलरशिपहरु कसरी लिन सकिन्छ तपाईहरुले के गर्नुभयो यो दौरानमा भनेर चाहिँ क्वेसनहरु आछ मेबी आई शुड स्टार्ट विथ डाक्टर प्रेरणा
Okay, so if we're talking about the cost of undergrad, so I think applying for scholarships is a great idea. I'm lucky because in Georgia we had something called a Hope Scholarship that was available to students who maintained maybe above a 3.5 grade point average if you went to a public university, which I did. And so if you maintain that kind of average, they would cover your tuition for that semester. So that was very helpful for me. Also during undergrad, I was an RA, which helped cover my housing costs because in Atlanta, I mean, well, compared to LA, but housing is expensive. And then that also covered some of my meal costs. So there are opportunities out there, whether it's scholarship or doing like working at the school that can get you compensated for some things. I highly recommend speaking with the financial aid office, whether that's your guidance counselor at high school or, talking, like physically calling up the financial aid services that are at each university to just kind of see what your options are. The websites can be very helpful, but I do better when I actually speak to someone who knows my situation. And then as referring to medical school, you can also get scholarships for medical school based on merit, based on need. You just have to go the extra step and try to figure out what those scholarships are, because sometimes they don't flaunt it around. And then with that financial aid, like if you're doing student loans or something like that, like I took student loans. I think a lot of people do student loans. It's hard, but eventually, you pay it off slowly by slowly, and it may take you many, many years, but if it gets used to somewhere that you're, having a fulfilling job and you're leading a fulfilling life, then, it's something to consider. Thank you.
Thank you, Prerna. So there was one question coming from the public that how do you guys feel about being in the medical profession and the COVID going on, with the COVID pandemic, even as practicing physicians, I have some apprehension. We have to take care of a lot of COVID patients. We use maximum PPE protection. And I'm sure you are all somewhat to that in that situation. I think at the beginning, I remember Jessica saying that she didn't have to see patients, but I'm sure at some point everybody had to see patients. So any regrets? It's like the pandemic is here, but you're all in the medical professions. What are your thoughts? Maybe start with Jessica.
I'll interject here.
Yeah, please.
When the pandemic started, I was in Washington, D.C. working at NIH. And I think that in itself was a really cool experience because NIH is kind of leading all the efforts in COVID research, and just being kind of on the inside scoop and hearing about what was going on was wonderful. I think it was awesome also just to see the leadership and how they handled that and how my bosses and all my work colleagues were kind of dealing with it. COVID has been a strain on everyone. I don't think it's, been easy for anyone, even just people who aren't in medicine. It's been a really rough time. For me, I've started medical school during a pandemic. So taking Zoom lectures, not getting to meet my classmates, and then, being taught patient skills over a screen, it's nerve-wracking. It makes me nervous about, okay, well, what about next year when I do start interacting with patients? What's that going to be like? But one thing that I really enjoyed during this pandemic is a lot of my friends, a lot of my family were asking me questions. They were like, what's going on? Like, I keep hearing about this virus, or, you know, you're at NIH, like, what's this scoop? And I think that in itself kind of confirmed that, because I was answering and I was really excited to tell them and kind of translate that science and say, well, here's, you know, how the virus works. This is what's really happening if you want the scientific, you know, answer, but, you know, this is what it means, like wear a mask, wash your hands, like limit, you know, social interactions. So for me personally, it just confirmed why I was going into medicine, and that was connecting to people, leading in science, and translating that science to the public.
I'll just briefly add, I think without getting too political, there's a lot of misinformation out about COVID currently. So I think kind of all of us in our own capacity, whether we're high school students or educated in science, you know, we all, I think, have the ability to find information and kind of vet information based on resources in Google. So I think all of us in our own capacity have kind of an obligation to, you know, when we see misinformation, to not necessarily cause conflict, but try to, you know, educate our fellow citizens. And, you know, even if you are a high school student, if you spend a little bit of, or someone not in science, if you spend a little bit of time reading reputed, reputable resources and what the experts have to say, and you see misinformation, then you can simply refer people to that information, because I think a lot of this pandemic has been driven by misinformation and a lot of people not necessarily having access to valid kind of, you know, solid evidence. And a lot of, I think, research papers about this pandemic are pretty complex and not necessarily presented in a way that's easily digestible for a lot of people not in science and medicine. So I think something we can do, if that's something we want to be more involved with or help with without getting, you know, directly into the pandemic and in terms of patient care, is to do what we can to educate ourselves and then also spread that information in a way that's communicative and valuable. So.
Go ahead, Promise ji, further questions?
फर्दर क्वेसन्स है, यो यति मजाले गइरहेछ हैन. फर्दर क्वेसन्स एकदम जेनरल क्वेसनहरु मात्र छ है मसँग. वेल है, स्पेशली अब तपाईहरुको अब जेनरल लाइफ हैन, एभ्रीडे लाइफ कस्तो हुन्छ है? इट्स भेरी इन्ट्रेस्टिङ हैन. अब यो स्टुडेन्टबाटै आएको छ है. दिस इज actually from my daughter, who is in high school. So she has a question that, what is your everyday life? Generally, case synopsis. Can we start from Jessica, maybe?
Sure. So I'm on clinicals now. So during my first 2 years, it was similar to undergrad, where you go to class in the morning, and then you take notes and you study. Everyone has their own different study style, especially in medical school. Our school had mandatory attendance, so we had to go to class, but not every school has that issue. So I liked going to class, though. I liked talking to professors, and I would just make myself pay attention in class, and it really went a long way for me because I'd have to spend less time after hours studying. But usually you end up studying until like 5 or 6. If you have a big exam, maybe it becomes 9 or 10. And then you like go home and eat, and you can eat in the middle of the day. But on clerkships, which is what I'm doing now, 3rd and 4th year, it's way more fun. You go to the hospital in the morning, you're on a different rotation every month. Right now I'm on obstetrics and gynecology. I'm doing L&D. So you're seeing patients in the morning, seeing people who delivered yesterday, talking to them, getting their histories and physicals. So you're just talking to them, checking out their body, seeing if they have any questions, any pain, anything you can convey to the doctor when they get there. Usually you do have to wake up a lot earlier than your doctor, so you can see them before, and when your doctor walks in, you can let them know, like, this is what's going on, this is what I think we want to do, and your doctor will tell you you're crazy, or they'll be like, great job. So it's an emotional roller coaster all day, every day, but, you know, I've had really great supportive mentors on my clerkships and had a fantastic experience on every single one of my rotations. Like, I can't even complain. So I think that's just shows how like satisfying and that I'm in the right field and I know where I want to be.
Great, thank you. So may I just go to Savannah?
Yes, so My first 3 years were didactic, so we actually had to be in class and, you know, listen to lectures and all that kind of stuff. And there was lots of tests. So my 4th year that I just started, it's just rotations. So it's basically just applying your 3 years of knowledge into real life. And it's actually really cool because you get to see all kinds of stuff. I just finished my first round of rotations, which was 6 weeks long. And it was at a herbal pharmacy, which was kind of interesting because all throughout school, we were taught not to use any kind of herbal supplements because they interact with the prescription drugs and, you know, they don't work. There's not enough evidence and all that kinds of stuff. But like with this rotations, being there for 6 weeks, like I actually saw that, you know, they do work. There's some that do work for some people, and you get to see that people, you know, a lot of people don't want to take drugs and, you know, they just want to stick to the naturals. And it was really cool. So my typical day with this past rotation was, you know, 9 to 5 or 8 to 6, just like a regular day. You just go there, you work all day, you basically shadow the pharmacist, you do the work for them and, you know, basically verify with them that you're doing the right thing. Patient comes for a consultation. Hey, this is what's wrong with me. What do you recommend? I've tried this, it's not working. What else can I do? So you think of a plan, you know, you ask for their history, you ask what they've tried, their doctors, all kinds of information. Then you come up with a plan and you basically, right now, you know, I'm not comfortable with just telling the patient what to do without verifying it with my preceptors. So come up with the plan, make sure that it's okay with the preceptor, and then you kind of guide the patient to do what you come up with. And so that was my schedule this past rotation. I start my new one on Monday, so I'm not really sure what my day is going to look like when I start that one, but it's just like a regular work day with every rotation.
Thank you. Dr. Sanjeev, you want to add something on this, or you have?
No, I wanted to see how Angela's workday is as a dentist.
Okay, not dentist yet, but almost. So I'm in my 2nd year now. So with dentistry, like it's a lot of hand skills, right? So we have a lot of lab work. I'm in class from approximately 8 to 6 every day. And it's about like 4-hour labs at a time. I'm also taking didactic courses right now. I'm like pharmacology. The important part is you have like a really full body understanding of how everything interacts, because you also are prescribing drugs. So you need to make sure for any of the antibiotics or anything else you give, they're not interacting with any of the things that the physicians are giving. So anyways, my days usually start, I like to spend time for myself. Like I'll exercise in the morning right before I go to class. I go to class until I get back at 5 or 6, and then I study until the rest of the day. Unfortunately, there's a lot of studying for every single thing that you'll hear about today. But for the most part, yeah, it's just part of the reason why I picked dentistry was so you have the ability to make a good work-life balance. So, you know, you just need to make time for that. You need to make time for your hobbies and things later. I meditate with my parents. I do yoga with them whenever I go home. I drive an hour home. I'm really lucky that I'm only an hour and like 10 minutes away from my parents. So I try to see them when I can. And, you know, it's something that I like to do with them. So just keep yourself busy, keep yourself sane, take those breaks, and, you know, you won't go wrong.
Thank you. Dr. Prerna, do you want to add something about your work life?
Oh, sure, briefly, I can. So residency is, you know, similar to the schools that y'all have already been talking about. I get to the hospital at 6 a.m. for sign out. Then I pre-round, I go see all my patients. Then we do what we call rounding, where the pharmacist, the nurse, the physicians, the residents, you know, the social worker, the dietitian, we're on Zoom now. It's not in person anymore. But we kind of go through each patient and talk with them, and the families can either join in on Zoom to hear what's going on with their child, or they will prefer updates later. But we do rounding for a couple hours, and then the afternoon, we're basically placing in orders, making sure tasks get done, touching bases with our nurses to, see if they need anything. And then kind of just wrapping everything up, and the sign out is again at 6 p.m. So you do sign out and then you go home. And, for me, I learn a lot during the day, whether it's reading up on patients and disease processes that I haven't seen before, or things that I'm not familiar with. So when I get home, luckily I don't have to do a whole lot of studying. I just kind of eat, decompress, do some yoga, watch a couple of shows, catch up with family or friends, and then go to bed and repeat. So, you know, this lifestyle is the residency lifestyle. It's not forever. You know, once you're an attending and you know, full-fledged trained doctor, I think it gets better, but Sanji Mama can, you know, elaborate more on that life.
Thank you, Prerna. So I think this session could go on and on, but I just want to briefly make a few comments. Sakshi Oza, she's studying to be a certified registered nurse anesthetist. She's on call and she had to leave. She's on call in the ICU. So there were many questions. And to summarize, the high school students want to know, what does it take to be where you guys are? Everybody wants to emulate you guys. So I just wanted to briefly summarize from what everything you've said to me was maintain your GPA. Number one, maintain your GPA, maintain the GPA. Number two, volunteer. Volunteer as whatever your passion is, volunteer. And for medical professional related, we are opening a TNMA health clinic that will be there down the road, and that will give opportunity for our high school kids to volunteer. Number three seems research. Get into some research project in high school or early in college. That'll help in broadening your horizon, knowing your mentors, knowing other people. Extracurricular activities. So everybody will have a closing statement in 1 minute. And if you could kindly just touch on what's the extracurricular activity that has really helped you. And number five, to me, seems like mentors. Have mentors, people who can guide you and you know, discuss the various options and lead you in certain directions. And along that line, as I mentioned, we at TNMA, all the doctors, physicians, dentists, and we can reach out to pharmacists, nurse anesthetists. We are very pleased and honored to be mentors and source of resource for all of you. So with that, I think if we don't have further questions, we might go to the closing statement from everybody 1 minute. And if you could kindly touch on those few points. To me, yoga seems like, or yoga or focus meditation seems like it has helped everybody. But if you could kindly just give 1 minute closing statement as to who has been your greatest mentor and what has really helped you to reach where you guys have reached. Maybe start with Jessica.
Everyone wants to start with me. I wasn't ready. Okay, so I think my greatest mentor, all the parents who are watching this right now, you know who you are. Like, it's not just one. My parents have been awesome, but I also have this giant village of DFW, Fort Worth, everywhere, Sanju uncle included, who have undoubtedly anything that I say, like, hey, I want to do this. They're like, all right, let's go. And they've supported it. And so I think that's huge to see. And I want to be able to do that for people in the future generation and pass that forward. You know, they're very willing to help you, very excited. They will pull all the resources. So that's one. The other thing, kind of things that I like to do to decompress, I like cooking. So I eat food and invite people over, and it's been really sad because of COVID. So you can see that I'm sad and alone right now, but that's okay. And I also really like exercising. So I really got into like weightlifting. So I like doing that, but because of COVID, that's been kind of limited. So I've been kind of doing my own thing at home. But it's definitely, you have to do what makes you happy. I tried to do yoga, didn't really seem like something that made me happy. So I picked something else. Other thing about, he was saying, keep up your GPA. I think an important thing to realize is that you are going to be surrounded when you get to undergrad by people who are just as smart as you, or like have had straight A's in high school and never had to struggle. And then, you know, you're going to get to one class and you might fail an exam, and it'll happen and you'll be horrified and scared and you won't be able to call your parents and you won't know what to do about it. Not trying to like make you feel scared, but don't be afraid to look for a tutor. Don't be afraid to ask your parents like, hey, I need some money. I want to be able to find a tutor because I need help. I know I can work on this, but I'm struggling. I think being able to ask for help is one of the most humbling and best things you can do for yourself so you can move forward, right? We can talk about this later if you have any issues, but definitely. Also, I put the Google form down in the Facebook chat. So if you're interested in having one of us as a mentor or any of the other people who have been volunteering to help out, fill it out. It's in the chat and I'll get back to you guys within a week or two.
The next we have Suvana Sivakuti.
So basically, like everyone said, parents, they are my biggest supporters as well. You know, from day one, whatever I wanted to do, whatever I was interested in, they've always just supported me. Besides my parents, you know, I looked up to my pharmacist a lot. When I first got my job as a pharm tech, he is actually the one that inspired me to go to pharmacy school. And, you know, the way he was doing things, the way that people were coming to him for recommendations, you know, the way he taught me everything, I just really wanted to be in pharmacy school and be doing what he was doing. So I consider him my mentor. I also have a really good friend who just graduated pharmacy school. She also really helped me with my application process, you know, even with the job, getting the job and just everything. I would, you know, stress out about my exams and just break down and cry and call her crying. And she'd just be like, this is a phase, like, you know, it'll be over, like, don't worry. And, you know, every professional school is hard. It's not easy to get to, you know, where we are, but also like, it's not just stressful. You meet friends. Like I met so many friends throughout the pharmacy school experience, and, you know, they're going to be friends for life. And we were just equally stressed about every single exam, every single experience. And we would, after it was over, we would get together and get lunch, you know, watch movies, do something fun just to de-stress and just be energized for the next week. So, so yeah, I think that's my piece of advice as well. Just don't just stress out, but also, you know, treat yourself after, you know, after your exam, after you've achieved what you wanted to achieve. So yeah.
Next, I would like to go to Adarsh Malla.
Sure. So I guess in my closing statement, I'll focus on kind of the question about where, you know, where you go to undergrad really matters. I think everyone applying, you know, in high school to undergrad, as well as when you know, apply to fields afterwards. Like I said before, I think where you go does matter to some extent, and you really should give your best effort in terms of applying and putting together a good application and you know, showcasing that you're doing things you love. But again, I would focus on the mindset of the idea that you kind of make yourself into who you are. It's not your location or, you know, a special professor necessarily or a special school with, you know, a certain name or ranking. What you actually do when you go. There's a bunch of people who came to Johns Hopkins and didn't necessarily do as well for a number of reasons. And there are plenty of people who go to other schools who are doing great. So again, it's not necessarily where you go to school. So I definitely didn't get into my dream school. And I think it's a very small percentage of people who do. So no matter where you go, have the mindset that you're there to work hard and you're there to do your best. And then if you do those things, then you'll get what you want. Essentially, don't be too focused on, you know, location making the outcome. And in terms of extracurriculars, I've kind of always really been interested in sports. So soccer and tennis have kind of been my biggest things since middle school. They are fun. They help you get exercise and feel good about yourself. They help you develop communication skills. They help you learn how to work into a team. They help you learn how to take directions from your coach. So if sports are something you're even slightly inclined to, I would suggest trying to get involved in those. So yeah.
Great, thank you. So I would like to go to Angela Adhikari.
Okay, just to kind of reiterate what everyone else has said, obviously our parents are one of our biggest support systems, but I'd also like to piggyback off what Jessica said. I'm obviously in dental school, and a lot of the doctors in the Nepalese community are physicians, so it's weird to say, but a lot of them have been my mentors too. Dr. Sapota, Dr. Shrestha, and everybody else has been really encouraging in the path that I chose to take. They've been saying things like, oh, your work-life balance will be great. Oh, like there's other like great benefits of choosing the career that you took. So just, you know, everyone knows, you know, the people that have made a huge impact in your life. So, you know, I'm very thankful to my parents for supporting me, encouraging me, and I'm thankful to all the doctors, every other mentor that I've had in the Nepalese community. But as for hobbies, I kind of touched on this earlier, but just taking the time to decompress and, you know, exercise, meditate, do yoga, see your friends. I know we're all busy, but you really just make time for what's important to you. So, you know, if your physical health, your mental health is important to you, you'll make time for it. And, you don't want to be that physician, dentist, pharmacist, whatever you chose to go into who burns out. So just really take the time to nurture those relationships, nurture those extracurricular activities. And yeah.
Thank you so much. Ani अर्को हाम्रो निकिता चापागाई.
Hi, yeah. So this question's pretty hard because I've been so blessed to have so many wonderful mentors in my life. My parents are just, I don't even have to say that. They have been my backbone for everything. But apart from that, in the field that I chose, because, unfortunately my parents they're tech people, so they don't understand the science world. So my mentor in college, actually, my PI, was a big mentor for me. He taught me a lot about research, taught me a lot about, what I would be interested in, and encouraged me to continue research. But apart from that, I could go into his office and talk to him whenever I was having a bad day or just really stressed out about other things. And so he showed me what it meant to be a good leader, not just in, the science that we were doing, but just, to be a personable person in my life. And so he's played a really important role. And, we still keep in touch. A lot of the doctors I shadowed in high school, I still keep in touch with. And, all the doctors I worked with until now, they are a part of my experience. They've shaped me in one way or another, good and bad. And I'm so thankful for all of those experiences. As for extracurricular, so I just started medical school about 3 weeks ago. So I'm still trying to figure out what works for me in terms of like studying. My day right now just looks like a lot of studying. I just had my first exam yesterday, and I spent probably 12 hours every day studying for the past week. So it was pretty brutal, but I'm still trying to balance, time for me. I love being outside. I love exercising. I like running a lot, hiking. I'm a big reader, so I like to read when I can. It hasn't happened recently because I'm reading a lot for class, but I hope to work it into my schedule soon. I like to journal. I like to just spend time with friends. And I think, even after this first exam and the first couple of weeks of school, you get very stressed and you get very overwhelmed. And I think just taking a minute to step back and say, why am I here? What's the reason? I worked for this for a really long time. And, I want to be working towards myself as well and growing. So that's always helped me.
Thank you. अब last but not least, Dr. Malla.
Okay, hi. So mentorship wise, especially when you're in high school, you may not, you may develop lifelong mentors while in high school, which is great. But, as you go through college and medical school, you'll have more focused mentors that are in the same field as you. But in high school, my teachers were definitely mentors for me. My coaches, band director, they're all teaching you really good skills about being disciplined, focused, trying your best. But they also pick you up when you're down. They're there to support you. So definitely, you can definitely lean on your teachers and coaches and things like that in high school. They just want what's best for you. They want to see you shine and be a star. So I think that they will be very willing to support you and, to the best of their ability. And then as for extracurricular activities, I'm definitely a sports person. I love soccer, ultimate frisbee. I'm getting into tennis now. But if you're not into sports, that's fine. If you love to draw, if you love to sketch, if you like to write poetry or just write short stories, that's wonderful. If you like to, if you're a musician, if you did band or marching band, concert band, all that stuff, that is excellent. So all of those things, it doesn't have to be an active thing or exercise or sports or anything that makes you feel fulfilled, that makes you feel good, that you can work on and, apply your discipline to is amazing. And, just keep doing those things because they're gonna get you through days that are really hard. So that's all I have to say. Good luck to everyone. And yep. Thank you for having me again.
Thank you.
Excellent. Thank you so much for our young professionals. You guys have done such a wonderful job giving this presentation to our high school kids. So in the interest of time, again, want to thank everybody. and also ask people to tune in to our next session. We'll continue this Facebook Live. Our next session is on August 29th. It will be a very interesting COVID and pregnancy. And in September, third week, 19th, we will have COVID and flu. That's when, you know, we're a little apprehensive about how the flu season is going to interact with the COVID pandemic. We pray that it will get a little bit better, but of course, we always have to follow science. Science trumps everything. But I'd like to thank everybody for being on this panel, and would ask Pharmacist to say some closing remarks. Thank you.
Thank you. Thank you, everybody. सबभन्दा पहिला त के म नेपाली नै ल्याङ्ग्वेज युज गर्नु बढी I'm just going, कमेन्टहरु पनि आइरहेछ हैन, नेपालीमा भए अझ राम्रो हुन्थ्यो भनेर, बट एनीवे इट्स भेरी भेरी फ्रुटफुल हैन। दर्शक पनि तपाईहरुलाई के लाग्यो यो हाम्रो प्रयास हैन, स्पेशली के त भन्दाखेरि यो हाई स्कुलमा जो छन् हैन, उनीहरुको लागि स्पेशली मेडिकल फिल्डमा जान खोज्नु भएकोहरु है, आइदर मेबी त नर्सिङ हुन सक्छ, मेबी डेन्टल, मेबी हैन अरु मेडिकल फिल्ड हैन, सबैको लागि भनेर हामीले यो डिजाइन गर्न खोजेका हौं। डेफिनेटली यसमा अब तपाईहरुका सबै कुराहरुलाई समेट्न नसक्या होला समय अभावले गर्दाखेरि। तपाईहरुलाई के लाग्छ यसमा एउटा प्रतिक्रियाहरु हामीलाई दिनुहोस् हैन। डेफिनेटली यो प्यानलले एकदमै राम्रो काम गरेको छ हैन। उहाँहरुले जुन प्रेजेन्टेसन गर्नुभयो इट्स भेरी भेरी हैन, कतिपय कुराहरु एकदमै पोजिटिभली इम्प्याक्ट पर्ने देखिएको छ भने, अनि अर्को के त भन्दा सबैभन्दा राम्रो पार्ट चाहिँ उहाँहरुले चाहिँ गुगल फर्म बनाउनु भएको छ है। इट्स अ भेरी गुड थिङ, नोबल थिङ हैन। उहाँहरुले जुन एउटा भोलन्टियर गर्न लाग्नु भएको छ हैन, वी वान्ट टु बी इफ यु निड एनी मेन्टरशिप वी आर हियर भनेर भन्नुभएको छ। इट्स अ ग्रेट थिङ जस्तो मलाई लाग्छ है। त्यो गुगल फर्मलाई राम्रोसँग युज गर्नु, स्पेशली whoever आर इन द यो हाम्रो हाई स्कुलमा हुनुभएकोहरु, द्याट्स अ ग्रेट टुल्स है। अरु त अब डाक्टर सञ्जीवले धेरै कुराहरु गरिसक्नु भएको छ, मैले समाप्त गर्नुपर्ने अरु कुराहरु त मैले देख्दिनँ है। दर्शक पनि तपाईहरुकै माया सल्लाह सुझाव हैन, र अहिले सन्दर्भ सान्दर्भिकतालाई लिएर हामीले सधैँ यो हेल्थ अपडेट हामीले सुरु गरिरहेछौँ, स्पेशली यो कोभिडको टाइममा हैन। धेरैको इन्ट्रेस्ट के थियो भन्दा एभ्री विक भयो अझ राम्रो भन्ने कुराहरु बारम्बार आइरहेको छ। हामीले कोसिस गरिरहेका छौँ हैन। यो समयमा डाक्टर साहबहरु धेरै नै बिजी हुने कारणले गर्दाखेरि हैन, एभ्री विक आउन नसके तापनि we are trying our best in every 2 weeks है। अब यति भन्दै आज टाइम धेरै नै गइसकेको छ, 1 hour 30 minutes we crossed, but thank you so much for your patience सबैको लागि, र स्पेशली हैन आजको म रिसोर्स प्यानललाई really हैन really appreciate। यो हाम्रो के त भन्दाखेरि नेपाली समुदायमा हाम्रो सेकेन्ड जेनेरेसन भनौं न अझ हैन, उहाँहरुले जुन एउटा आफ्नो प्रोफेसनलिजम, त्यसपछि what we are doing, look we are here to help you भन्ने किसिमबाट जुन एउटा लिडरशिप देखाउनु भएको छ हैन, इट्स भेरी भेरी अमेजिङ। र यसरी नै के त भन्दा हाम्रो नेपाली हाम्रो यो कम्युनिटीहरुमा चाहिँ अरु फिल्डमा पनि यसरी नै यो युथहरु अगाडि आएर मेन्टरशिपको लागि गर्नु होला भनेर हामीले सोचेका छौं है। इट मे बी वन एक्जाम्पल। यति भन्दै दर्शकवृन्द, डाक्टर सञ्जीव सँगसँगै टिम टिएनएमए लगायत आजका हाम्रा रिसोर्स व्यक्तित्वहरुलाई नमन गर्दै आजको प्रोग्राम बिसाउने तर्खरमा छौं है। अब अघि डाक्टर सञ्जीवले भनिसक्नु भयो, हामी 29 मा फेरि आउँदै छौं। त्यसै गरिकन अरु प्रोग्रामहरुको बारे, टपिकहरुको बारे हाम्रो सजिलो छ है, फेसबुकबाट हामी कुरा गर्दै गरौँला। तपाईहरुका क्वेशनहरु के छन् कृपया पठाइदिनु होला। यति भन्दै आजको यो प्रोग्राम म बिसाउने तर्खरमा छु। गुड नाइट, थ्यांक यू।